morning, Marist. I have breaking news for all of you. An outbreak of sickle cell disease, also known as sickle cell anemia or homozygous sickle cell disease, has taken over campus. Reports of students feeling sick have been flooding in. Sickle cell disease is when red blood cells have a DNA mutation and take the form of a sickle shape, which kind of looks like a banana. This shape can interrupt blood flow and in turn cause many problems in daily life. Be aware of these symptoms. The most common is anemia. Some cases of anemia may include being dizzy, short of breath, or tiredness. Pain crises, aka sickle crises, where sickle cells move through small blood vessels, get stuck, block blood flow, and cause pain. Jaundice or yellowing of the skin can happen, or acute chest syndrome, where sickle cells stick together and block oxygen flow to vessels in the lungs. This is life-threatening and often caused by stress. Splenic sequestration is when sickle cells get stuck and fewer red blood cells can move, causing hemoglobin to drop. Priapism is also a possibility concerning erectile dysfunction. A stroke could occur because of this disease and even cause severe brain damage. Here to comment is Catherine, a real-life Marist student claiming to express some of these symptoms.
I'm so scared. I don't know how I could have contracted this terrible disease. I've been really tired recently, and I've been dizzy like once or twice this week. Also, I think my skin looks a little more yellow than usual.
Well, I have good news. Joining us on NBC is renowned Dr. Montembeau.
Eleanor, it is not possible for there to be an outbreak of this disease because it is actually a hereditary disease. This means that you can't catch sickle cell disease, you are born with it.
Well, that's a relief because it seems pretty serious. Tell us more.
Sickle cell disease, for short SCD, is an autosomal recessive disease, which is a mutation of DNA on a recessive allele. Both parents have to contribute mutated DNA for SCD to affect someone. Autosomal means that the disease is not carried on the sex chromosome. For example, the pedigree of my friend's family demonstrates how this disease can be carried but not expressed throughout one or multiple generations.
My dad was heterozygous for SCD, meaning he carried the DNA mutation but did not express it because it is recessive. My mom is also heterozygous for sickle cell disease, meaning all of my siblings and I had a 25% chance of expressing SCD, a 50% chance of being a carrier of SCD, and a 25% chance of not having SCD at all.
Some groups of people are more likely to carry SCD than others, such as Africans, people with Mediterranean heritage like Greeks, Turks, Italians, people from the Arabian Peninsula, Indians, South Americans, and Central Americans.
This is all very interesting, Doctor. Are there any known cures for SCD?
Well, it depends on symptoms, age, general health, and the severity, but there are several things you can do to combat SCD, including pain medications for your sickle crisis, drinking 8 to 10 glasses of water or IVs to prevent and treat pain crises. Blood transfusions can be done to treat anemia and prevent stroke by diluting sickle hemoglobin with normal hemoglobin. Similar to this is red blood cell exchange, which removes abnormal red blood cells and replaces them with healthy cells from a donor. Vaccines and antibiotics prevent infection, while the vitamin B and folic acid helps prevent severe anemia. Hydroxyurea is a medicine that reduces the frequency of pain crises and acute chest syndrome. Another medicine called voxelotor also reduces pain crises and improves anemia as well. Crizanlizumab and E-glutamine are both medicines for reducing pain crises. Regular eye exams can help screen for retinopathy. A bone marrow transplant can be performed and even cure some based on severity and suitable donor. Finally, very recently, gene therapies have been approved that can accurately edit mutated DNA and then graft it back into the bone marrow to start producing regular red blood cells.
Wait, so I don't have sickle cell disease?
No, probably not. SCD is usually diagnosed at birth, but if you're feeling dizzy and tired, you should probably get some sleep.
Bye, guys. See you guys next week.
No one told you life was gonna be this way.